Hi guys, Amanda Curtis, nurse practitioner, and in this episode I wanted to kind of break down how I do an aesthetic consult and how I talk with my patients about aging specifically and how we combat that and how we make a plan to space out their treatments, but to also give them a roadmap and a way forward. All right, so I'm going to begin with a little bit of story time, but I have this book. It's from Codafana, and it's a facial anatomy book. So I like to show this and bring it to you all's attention because we have to look at the face in layers. Okay, so we understand, and maybe for some of you not in the medical field, this is a different topic, but when we're learning facial anatomy, we look at the layers of the face. So understanding that each of these layers ages at a different rate, but they all do age. And for the most part, everyone ages the same, right? We lose our bone, our fat pads remodel, our skin loses elasticity, things start to move and shift. But if we understand what's occurring, we can understand how to reverse that appropriately. Okay, so one of the first places I love to start is the bone, because it really bone sets the tone, is what I've heard before, but it is the foundation for your face. And as we age, I'll show you a picture because I'm very visual, but look at this mandible. So this is the mandible of a 20-something-year-old, and this is the mandible of, an older person, a more mature person, but they've lost, you see the recession of the bone, you lose the angle, things start to be reabsorbed. So what that means is this bone right here starts to move this way. And think of it like a table and a tablecloth. If the table is no longer the same size, if it's getting smaller, the tablecloth that lays on top of it is not going to lay correctly. It's going to look like the tablecloth is too big now because the table is smaller. So if I like to replace bone, first place I start with my patients, because then we can do less more superficially if we have the foundation is right to begin with. The next area that I like to address is, when I look at a face too, I also like to do top, down, out, in. So this is called the line of ligaments, and anything lateral to the line of ligaments is going to help with repositioning and lifting the face. So as you can see, you can look back, I look at photos of myself, you can see this hollowness that's starting to happen here in my temples. You can see this is at my temple fusion line. And so what I would do, one of my first places that I like to look for my patients is that replacing the volume here will help to lift and reposition the rest of the tissue more anterior to it. So temples first, top down, and then out in. They're vector to this, but we have deep to superficial. So I like to work deep to superficial. Using a bioregenerative approach, that means replacing something that is most like bone, that is biostimulatory, deep to bone if we can, and in the places where it's appropriate, we'll use appropriate products. So this just kind of gives you guys an insight into how I look at a patient, any patient that walks in my door, and what's happening with them, how are they aging. And what we want to do is replace what is being lost. And if we know what's being lost, we start there first, and then everything downstream of it will improve that much more. So I have to add less. I never like to fill nasolabial folds. It's just, why add to an area that's already becoming heavier as we age. So when we replace what's being lost, and everyone, when they go in for a consultation for surgical procedures, they say, I want this, I want this. Well, where are your hands? They're back here, because this is where you've lost your volume and your bone, and things are not laying correctly. So this just kind of brings me to the point that aesthetic medicine actually taught me a lot about root cause medicine, and that being, you'll have a patient come in and they tell you a symptom. The symptom, I don't like the nasolabial fold, or I don't like the hollows under my eyes, or I don't like this. But what's actually happening is a deeper problem. Okay, so that's going to be the volume loss that has occurred here, but the symptom is here. So we're looking for the root cause of what is occurring, and our fat pads are repositioning, the orbits are getting bigger, the piriform space is getting wider, our jaw is receding up. So these are the things that I look to correct on most of the patients that come through my door. And it's a plan. If somebody comes in and I just want one syringe of filler and fix my face, that's not a realistic expectation. And really what we need is a comprehensive plan to combat the signs of aging. So that's just a little bit of the way that I run my consultations for my patients. And I think it's one of the best things we can do as aesthetic medicine practitioner is to have a plan for our patients and not let them dictate just because they have one line that they really don't like, but that line is the cause of some volume loss somewhere else. All right, so let me know what questions you have down in the comments and I'll be happy to answer them. All right, I'll see you guys next time.